Imagine being able to quickly and accurately diagnose nerve disorders such as clinical depression, schizophrenia and Parkinson's, as well as Meniere's, Alzheimer's and bipolar affective disorder. Introducing EVestG, a breakthrough concept with potential to objectively measure and diagnose many nerve disorders. It is low cost, quick, and can be operated by a medical technologist from any location with computer and internet access. EVestG measures nerve function, much like ECG measures heart function. It may well also be possible to use EVestG to identify a nerve disorder even before the patient has noticeable symptoms. EVestG works by tapping into the electrical signals that go from the inner ear's balance organs to the brain and back during movement. Specifically, when a healthy person moves, the nerves attached to the inner ear's balance organs send signals to the two balance centers in the brain. The balance centers have nerves running from them to the brain's emotional, behavioral and motor centers, which in turn reflect the signals back to the balance organs. For most nerve disorders, the signals that hit the diseased brain centers are altered in specific ways before they're sent back. These altered signals can be picked up and measured accurately by EVestG. They can then be easily compared to signals from healthy nerve function. The potential of EVestG is as a tool of choice for early diagnosis of nerve disorders in much the same way as ECG is currently a tool of choice to diagnose heart disorder. Early diagnosis and treatment with the right drug is good news for patients. The results are a better patient outcome and a lower overall cost burden for health systems. Preliminary EVestG curves have identified unique patterns for clinical depression, schizophrenia, Parkinson's and Meniere's. Researchers believe EVestG may also be able to identify patterns for bipolar affective disorder, attention deficit hyperactive disorder and Alzheimer's. EVestG has shown potential to assess the effects that drug and physical treatments have on managing some disorders such as Parkinson's and depression. This suggests that EVestG has a use in clinical trialing and development of new therapies. Examples of the distinct EVestG curves for clinical depression, schizophrenia and Meniere's are shown here. EVestG also appears to confirm the effectiveness of some therapies for nerve disease. Following particular treatments, the EVestG curve has been found to shift back closer to near normal patterns of nerve function. For example, this EVestG curve shows changes in a patient with Parkinson's disease before and after taking their L-DOPA medication. This EVestG curve shows changes in a depressed subject before and after targeted physical therapies. Globally, the estimated cost burden of nerve disorders, including new drug development, is more than $1 trillion US a year and growing. EVestG has potential to cut these costs significantly. EVestG was developed at Monash University, one of Australia's top research universities. The technology is the subject of worldwide patent applications. Neural Diagnostics is collaborating with Monash University and Melbourne's Alfred Hospital Psychiatry Research Centre to set up its first clinical EVestG facility.